Hello, ladies. I'm Brooke Meinema, and I am the clinic director here at iMove for our women's health team. So we have a really great thing planned for you tonight to go over a little bit more about what our MyCore Floor program is and how we are able to address your pelvic floor needs. So without further ado, let's get into Brittany, who is the creator of the MyCore Floor program.
Thanks, Brooke. We'll go ahead and get started. And like I said, if you guys have questions as we're going through, go ahead and use the chat box. That'll be a great way to sort of for us to record your questions and be able to answer everything at the end. Like I said, I'm hoping that at the end we can really save 10, 20 minutes to answer whatever questions you guys have, whether it's about the presentation or about anything pelvic health related. So tonight's goal is to talk with you about how to stop the 3 pelvic P's. So peeing, prolapse, and pain. Those are always what I call the big pelvic P's because those are the biggest problems that as pelvic floor PTs that we tend to see, whether it is problems with incontinence, problems with urgency, frequency, difficulty fully emptying your bladder, whether it's problems with prolapse issues, which is where the internal organs start dropping into the vaginal canal. That can sometimes be a problem. And then the other big thing that we tend to see are pain issues, and whether that's pain related to trauma, abuse, other injuries you've had, whether it's related to endometriosis, related to a variety of things can cause pelvic pain. And so those are the big things that we tend to see. So those are the big ones we're going to sort of chat about tonight, as well as giving you guys a little bit of a better education about what your pelvic floor is, why what we do as a pelvic health team is so important, and how we can try to help you not to have to deal with these issues, either to treat them if you're already dealing with them or help you to be able to prevent them. So I'm going to get scrolling here and we'll jump in. So have any of you guys ever heard or maybe thought to yourself any of these sort of things? It's normal to leak after you have kids. Oh, my mom and my grandmother leak too. It's just genetic. I've just had this problem for years. I've tried Kegels and they just don't work for me. Exercises might work for some people, but not me. Or maybe you've heard some of these. They told me I just have a low pain tolerance. I just have to deal with it. Bladder issues and prolapse are just a normal part of aging. I just have to live with it. Oh, it's just part of menopause. Or I'm dry down there, but it's just because I'm old. There's a lot of excuses that we as women make, and a lot of sort of myths that are out there related to pelvic health and bladder health. And we're going to talk about those tonight, and we're going to try to debunk some of the big ones that you've heard about. So I want you to meet a friend of mine. This is my friend, Sheena. And Sheena, just like you, has dealt with pelvic floor issues. And I want to play a little video that she did when I was doing an interview with her. And I want to see if maybe you can relate to some of what she's saying. Ooh, let's see if will my video not play? Hold tight there. Technology issues. And I tested it earlier to make sure it played. Let's see if I can, if I can't, then I'll just have to tell you her story. Looks like I have it embedded, but it's not going to play. So let me tell you a little bit about Sheena. So Sheena had her first child. She was a super active runner, gym goer, had her first baby, and shortly after began having what she describes as just pressure in her vagina. She was having some leaking. She was trying to get back to working out and just wasn't there. So she went to her doctor in her postpartum days and said, you know, I feel this pressure. I want to be able to sort of get back to doing the things I used to do. And her doctor said, oh yeah, you've got some weakness down in what they called her vaginal vault. You have some weakness in your vaginal vault. Just do some Kegels, you'll be all set, and send her on her way. No pelvic PT referral, no other education about why she was having this pressure, why she was dealing with these things. So not knowing much, she went home and just started doing Kegels, and they didn't work for her. And she was super frustrated. And through a mutual friend of ours, she ended up coming for pelvic PT. And this is Sheena now. So if I scan forward here, I'm getting when Sheena was starting, like I said, she was not able to go back to doing any of the things she used to love to do. After doing pelvic PT, after learning exercises and ways to work her pelvic floor that went beyond doing just Kegels, this is her now. So she's now able to jump and do regular workouts. She plays with her kids on the trampoline. This was actually a clip from an Instagram post that she did. Jumping out my anxiety with my mini me, thanks to my core floor, no leaking after 2 kids in 2 years. And she's back running. So I share this story with you because I want you to know that it's possible. I want to open your mind to the fact that there's more than just Kegels. There's more than living with pads. There's more than surgery and medication. And yes, it's possible. Even if you've been dealing with this for a long time, even if you felt hopeless, you've tried some other things, I want you to keep your mind open tonight that there are possibilities of getting better. And we're going to open you to some new ideas tonight. So that said, my computer is, oh, there we go. Okay. If these feel like things of the past for you, intimacy, running, playing with your kids, your grandkids, we're going to tell you tonight how we can get that back in your life. So we're going to talk about the 3 pelvic Ps: peeing, prolapse, and pain. So I want to give you a little bit of my backstory. So my name is Brittany, and I have been a pelvic floor physical therapist for going on 21 years this coming year. I had to think there for a minute. I have devoted my entire professional career to helping women just like you. So very early on in my first year of PT, I was introduced to a pelvic PT. Our program was growing. I took the training and the courses and I went from there. And when I started treating, I treated very traditional with just Kegels and table work because that's what I was taught. But I got frustrated because I had patients like Sheena early on who were doing the things that I was telling them to do, but weren't seeing the success that I was hoping they'd see. So I started looking for other training courses, other ways to expand. I started looking into more preventative stuff for women. Like, why were women waiting until things were so bad or they had been dealing with these issues for years before they were getting the help that they needed? And so I began exploring, I began teaching classes, I began looking into doing online stuff, which is what My Core Floor is. And so now I am the CEO and co-founder of My Core Floor. I still treat clinically as a pelvic floor therapist. And I'm here tonight because my goal, just like the goal of the entire pelvic team at iMove, is to bring you guys better education, better treatment options than just Kegels, pads, surgery, and meds. We want to give you other options, help to improve your quality of life. And that's really our main goal with wanting to do this webinar, is to really just give you guys more options, more treatment. When I'm not being a pelvic PT, this is my family. You can find me spending time with my husband, my 2 kids. I have 2 teenagers and a black lab puppy. On the right here, that's my extended family. I have a sister and a brother, and they have kids, my niece and nephews. So you can find me just a regular mom like the rest of you. Also, in addition to just being a girl who likes hiking with her dog and likes being with her friends and her family, I also have a grade 2 prolapse. So I can speak to you guys tonight as a busy mom, a busy business owner and professional. I can also speak to you tonight as a pelvic PT, and I can speak to you tonight as someone who was diagnosed with a pelvic floor prolapse 14 years ago after the birth of my daughter. And knock on wood, has been completely asymptomatic since that time, because I've done all of the things I'm going to talk with you guys tonight about. So I just want you to know and knowing what it feels like to be diagnosed with one of these issues. So I'll have you guys silence your phone. Like I said, I put everybody on mute just so there's not a lot of background noise, and we're going to chat for the next half hour, 40 minutes or so, okay? So the goals for this webinar, we already talked a little bit. We're going to myth bust some. We're going to educate. I'm going to talk to you guys about My Core Floor, which is the online program that I developed that we're working with iMove. They are bringing it to you free of charge because they care about you guys getting good education and good exercises. So we're going to talk about that. And we're going to offer you guys a special bonus just for coming tonight. And this is a bonus that's just for you guys. So we want to chat about that a little bit. So tonight's bonus offer, just for coming, is a free 30-minute in-person screening with a trained member of our iMove staff, one of our pelvic health PTs. This is usually valued, guys, at around $75 if you were going to sort of go pay, cash pay for a exam with a trained pelvic PT. And so we want to offer that for you guys tonight. And Brooke, I think, is in the chat, is going to put a link for you guys to register for this screening. And I want to encourage every single person that's on here tonight to please sign up for a screening, because this is a free offer for you guys to go see a pelvic PT, for them to look at your body, look at what's going on, hear your story, and help you to start making some changes in your pelvic health. And so again, take us up on it. We want to do better by you. We want you to have better education. And one of the best ways to do that is to meet with a pelvic PT who can really hear your story and get you started on the right path. So that's tonight's offer, and we'll chat, and I'll remind you guys at the end that you guys can sign up for that. But in the meantime, free access to my core floor is available to everybody. And iMove started offering that a couple months ago. And so if you guys go ahead and register, you can do it through the iMove page, and Brooke may have that link as well. My core floor is an online platform that I developed. I have a personalized quiz that women will take. That quiz gives you a score, which basically tells you how your pelvic floor sort of is doing. Do you score really high? It's sort of like a test in school. If you get 100, your pelvic floor is great. If you get like a 60, it's maybe not so great. And so based on your score, we give you a personalized workout calendar. We give you routines to do. We give you structure. We have live classes that you can come take. We also have pre-recorded classes. We have workouts that are 5 minutes long if you're a super busy working mom or woman and you need to sort of fit things in quickly. We also have 40-minute classes where you can come kind of burn some calories, get a sweat on, and work your pelvic floor together. So we try to meet people wherever they're at. We offer a live community, so a Facebook group where you can talk with other women who are also dealing with these issues, as well as chat with pelvic PTs. It's education, it's support, it's exercise. And so it's a great place that if you're not ready to come in for a screen yet or get started with PT, you could at least start there with getting some additional information. But I'm really encouraging you guys to try tonight to get signed up for that screen. We'd love to get you guys all in and get you on the right path. And so pelvic health is a step-by-step process, and my core floor is also a step-by-step process. There's a welcome video, there's a quiz, there's a calendar. We guide you through it. And I find that people do the best when they sort of know exactly what's expected of them and they have a process. And that's how we like to run pelvic PT. That's how I like to do my my online program, because I think it's really important for people to know their expectations and how they can find the most success. Okay, so let's get into the nitty gritty. What is the pelvic floor, and how on earth can exercise and education make my pelvic symptoms go away or make my pelvic symptoms be better? And so what I'm going to do right now is I'm going to stop sharing, and I am going to go through and do a little bit of education stuff. So, and then we'll jump back onto the PowerPoint. So I'm going to stop that for now. And I am going to take a quick drink here. And we're going to get chatting a little bit. So most women I work with and find is that they come in to see me and they don't really know a whole lot about their pelvic floor. Okay, so they have heard about it. They sort of know there's some organs down there. They know they should be doing Kegels, and that's sort of, all they have. Okay, and so I want to explain tonight what your pelvic floor is, how it works, and why there's more exercises and things you can be doing other than Kegel exercises. Okay, so I'm going to pull up my handy dandy model because I feel like that's always the best way to sort of show things. So here is the pelvis. All right. Just to give you a little orientation, these are the pubic bones in the front. This is the spine in the back. Okay. And here's your pelvic bones here. This here is your hip socket. So that is where the femur comes out to go into your leg on both sides. Okay. And if I tip the pelvis, you can now look inside of it. And what you see is basically what looks like a soup bowl. Okay. It looks like a soup bowl of muscles down there. That is your pelvic floor. When you hear someone reference the levator ani, when you hear them talk about pelvic floor or doing Kegels, these are the muscles that they're talking about, that they're referencing. Okay. And so I want to show you a few things about them that are really important and sort of critical to understand. Pelvic floor attaches to the tailbone, which is right here, or the coccyx, and it also attaches to the sacrum, which is your lowest part of your spine, okay? So the first thing I like to educate people on is the fact that their spine and their tailbone have a close relationship with their pelvic floor. So I would say 98% of the people that I work with have had some sort of back or spinal issue or, excuse me, hip or bursitis issue that is also going on alongside their pelvic floor, okay? And the pelvic floor problems they're experiencing. And that's because your pelvic floor literally sits at the center and it attaches to your spine. So if you've had issues with stenosis or disc problems or nerve issues or fractures of your spine, it's going to impact how your pelvic floor is able to function, okay? And most people don't realize that. The next thing I like to point out is this big muscle that sort of flaps over here on the side. It's not part of that soup bowl of muscles. That's your hip rotator. And so it helps to control your hip moving out and your hip moving in, okay? And so again, not part of the pelvic floor, but it sits right on top of it, which means it has a really direct impact on how your pelvic floor functions, okay? So again, there's a big relationship between, if you've ever dealt with hip bursitis, IT band issues, tendonitis, hip fractures, a variety of hip things can relate to your pelvic floor, and they can influence how your pelvic floor is functioning. The next thing I like to point out is that your pelvic floor also attaches to the pubic bone in the front, okay? And that's where your abdominal muscles come down and in. So if you've had abdominal surgeries and you have some scar tissue, maybe you've had C-sections, maybe you've even just had scopes with those little tiny incisions, any sort of scar tissue in through here will impact your pelvis, and your pelvic floor attaches directly to your pelvis, which means abdominal tension, abdominal cramping, scar tissue, abdominal tightness can also impact the pelvic floor. I also, because of that connection, I see a lot of women who their pelvic symptom is abdominal pain and sort of undiagnosed abdominal pain. They maybe have had endoscopies. I've had women who've come in that have had colonoscopies. They've gone to see, gastroenterologists, and they can't figure out why their abdomen is hurting. And when we go in and do a pelvic assessment, we find that their pelvic floor is super tight. And so I have found where that front part of the pelvic floor, where it attaches in the front here to the pubic bone, can actually refer and cause pain into the lower abdomen. I was working with a client earlier today, and as soon as I got into that region, she was like, oh my gosh, I feel the abdominal cramping that I get sometimes. And so it's really important to understand that your pelvic floor, yes, it's down by your vagina, but it impacts so many things in this entire ring. And it's also impacted by so many things, meaning that it doesn't work in isolation. So the big thing I tell people is your pelvic floor, you learn to use it when you're really young, right? We all potty train our kids, or grandkids get potty trained, or our friends have kids that are potty trained. And I guarantee they never show them this model. They never teach them Kegel exercises, but magically every child potty trains, and magically all of you potty train without ever sort of having this background, without at 2 years old learning how the pelvic floor works. And so the key is understanding that you don't have to consciously be contracting and doing Kegels for your pelvic floor to work, because that's not how it started working in the first place, okay? But when we get older, for some reason, we start telling women that they have to cross your legs if you're gonna sneeze, squeeze your muscles, do a Kegel, brace your abdomen. And we sort of lose sight of the fact that when our pelvic floor first started learning how to work, we didn't do any of that. We were 2 and 3 years old. We were learning to potty train. But what does a 2 and a 3-year-old look like? They're up, down, twist, turn, moving. It is movement that starts to stimulate their pelvic muscles. And so I want to talk a little bit about that. I'm going to flip my model over because for teaching purposes online, it gets a little easier to see this. So this is the backside or the underside of the pelvic floor. So here's your tailbone still, okay? Here's your sacrum. And these are your main pelvic floor muscles, okay? This would be your rectum, and this would be the vaginal opening, okay? And you can see I drew arrows on my model, and what those arrows represent are the direction that the muscle fibers run in, okay? So you might be thinking, who cares, Britt? So my muscle fibers run in some different directions, okay? But it's critical, and I feel like it's a missing link in a lot of pelvic health treatment sessions and therapies. And so these muscle fibers run vertical, okay? Which means that in order for those muscle fibers that run sort of front to back to contract and relax, we have to move them in a way that's going to cause them to contract and relax, which is when our pelvis moves forward and back, those muscles contract and relax, okay? These muscles here on the side, because it's shaped like a bowl, they start to sort of wrap around. These fibers start running more lateral or side to side. Guess what? For those muscles to contract and relax, we have to be able to move side to side to create that contraction and relaxation. These muscles here, all the way in the back, run completely sort of horizontal in a different direction than the other two, okay? Almost actually perpendicular to the ones in the front. They run horizontal in the horizontal plane, which means they actually do the best with rotation of the pelvis, okay? So 3 ways to work your pelvic floor muscles: moving forward and back, moving side to side, moving in rotation. Think about those little kids that are potty training. What do? Up, down, twist, turn. They're always moving, okay? What do we not do enough as adults? We don't move. We do a lot of sitting. Kegel come into play with all this, you might be wondering. A Kegel is an isolated contraction of all of these muscles together. So all of these muscles together can lift and contract to do a Kegel and then relax back down. The same thing also happens when you do a squat or a lunge. Any sort of vertical motion will have you contract and relax. So I'm just peeking at the chat here quick because I see a couple things coming in. Let me just answer a couple quick questions here. All right, so if you do vertical motion up and down, that will also contract your pelvic floor as a whole, okay? So 4 ways to get your pelvic floor working, okay? You can move forward and back, you can move side to side, or you can rotate, okay? So, or vertical, I got all 4. Vertical, forward and back, side to side, rotation. Okay, so if you are only doing Kegels, and that's the only thing anyone ever told you to do, that means you're working the vertical, you're working the up and down, which is great. But if you're taking a quiz and there's 4 questions and you answer one question completely right, super right, very right, perfect, but the other 3 you get wrong, you still only score 25% on that quiz, okay? So it doesn't matter how good you're doing your Kegels and how perfect they are, if you're not moving in the other directions, you're missing out on 75% of how that pelvic floor can activate and can move, which is huge. So what happens is that we need to be able to engage that pelvic floor in all directions, okay? So we need to move it vertical. There's a place and a time for Kegels. Kegels have a space. I still do occasionally some Kegel training. So it's not like Kegels are no good, but they're not the end all be all. And that's, I think, where the big problem comes. It's all you read about in Parenting Magazine. It's all you hear about from doctors. It's all you hear about from your friends or your grandmother or your mother. So the big thing is not thinking that Kegels are bad or they don't work, but thinking more along the lines of the fact that you're only working one way out of 4. And so if you're only working one way out of 4, you're not going to get the maximum benefit out of that pelvic floor. Now, I want to talk a little bit about how a muscle works, because I think that can be a little confusing too when you're thinking about the pelvic bowl and you can't see it and you can't sort of see the contraction. And like I said earlier, you don't sort of feel the contraction. When you were 2 and 3 years old potty training, you didn't feel your pelvic floor engaging, it just was. So I want you to think about the bicep. I always feel like that's an easy one to sort of see and conceptualize. If you want to get a strong bicep, you grab a weight and what do? You start doing curls, right? So you curl up and you shorten the muscle. You curl down and you lengthen the muscle. And if you do 7 to 10 and a few reps, all that sort of good stuff, what'll happen is the muscle will get blood flow. Those muscle fibers will contract and relax. You will get stronger. You'll get a big bicep, okay? If you grab a weight and you just hold your bicep like this all day long, you just hold it in place, your bicep will actually start to get weaker because those muscle fibers are just staying shortened and contracted. They're not actually getting to relax and contract, which is how a muscle builds strength and gets blood flow. They're just staying contracted, so the muscle gets weaker over time. If you hold the weight out here all day long, your muscle just stays elongated. The fibers are also not contracting and relaxing. And so what happens is the muscle gets weaker. The arm has to move in order to trigger the fibers to contract and relax. Now let's apply that to the pelvic floor, okay? I just told you, your hips, pelvis, and spine, all the things related to how the pelvic floor connects, have to move in each of these directions in order to get those muscle fibers to contract and relax. And now I want you to think about what we do as adults. And I just said it a little bit earlier. We do a lot of sitting. We do a lot of fixing our pelvis. I see a lot of women, and I see it I do beach body workouts in addition to my core floor stuff. And I hear it sometimes in the beach body workouts even, which is a pretty popular sort of workout program, where people talk about bracing your abs and pulling in your pelvic floor and holding everything tight to stabilize your low back and to sort of brace everything. And that's not bad. But the problem I've seen as a pelvic PT is that women start living there. It's sort of like walking around all day, holding your bicep like this, hoping it just gets stronger. Women start sitting in these fixed postures. I had a woman a couple weeks ago who said to me, so what you're saying is I shouldn't be sucking in my belly all the time? And I was like, no. Sucking, like anything in life, sucking in your belly, bracing, holding, working things to be tight and stable isn't bad until it becomes the only thing you're doing. If you lose the ability to move, your pelvic floor is going to get weak, no matter how tight you're trying to hold everything. You have to learn how to move. There has to be a balance between the stability work and the strength work and the mobility work, because truthfully, how a muscle gets stronger is to move. You can add weights, you can add sets, you can add reps, and you can do all the same thing with pelvic floor work. In the my core floor stuff, I do things with weights, I do things in different directions, I do things with different depths. So all the same ways you would strengthen any other muscle, you strengthen your pelvic floor. But for some reason, that's sort of gotten forgotten in sort of the initial world of pelvic health. And so that's what I want to talk with you guys tonight about, is that there are other options and other things you can do. Now, nobody wants to sit for this entire time. I get it, me neither. I'm just telling you that sitting isn't good for your pelvic floor. So let's just take a quick minute. I want everybody to stand up, and I'm gonna just adjust my camera a little bit so you guys can see me. I wanna do a little exercise so you can check your pelvic mobility, okay? So everybody go ahead and just stand up for me real quick. Just find a little space to move in. Let me see if I can push my camera back a little bit so you guys can see my feet too. All right. Okay, so while you're standing, I want you to just have your feet shoulder width apart to start with, okay? And then put one foot forward. I don't care which foot, we're gonna do both sides, okay? Hands on your hips. I want you to just do a little forward back rock, okay? I don't want you to think too much about it. I just want you to do a little bend on that front knee. So if you're looking at me here, sideways, this is all I'm doing, okay? Now, as you're doing that, okay, I want you to now look down at your back foot. Is your back foot straight or is it pointed out a little bit? Now, I want you to think about what your knee is doing. Is your knee straight or does your knee want to bend a little bit? Does your back heel want to lift up a little bit? What's sort of happening there? And the reason I say that is because those are all cues and things I look for when I work with clients and when we work with clients. We look for how the rest of their body moves. Are you, as you're sort of moving forward and back, do you feel it in your spine? Do you feel like you're doing a little bit of this? Okay, those are all ways that your body finds to compensate when your hips and pelvis aren't moving well. When you're used to staying sort of tight and fixed here, your body will look for someplace else to get that motion from. If you're tight and restricted, your foot will often turn out because that's sort of a way to bypass that tightness. If you are used to using your low back, if you're someone that's had low back pain issues, probably that's where you start to compensate when you try to go forward and back. The knee is another place that a lot of my pelvic patients have had knee pain. Why? Because they start wanting to do a lot of excessive bending to try to get their pelvis to move. But what happens is I do that, my pelvis doesn't actually get a lot of movement, okay? It just sort of stays in place and I'm just sort of bouncing and getting my knees going, okay? Switch feet. I want you to do the same thing on the other side. Just get a feel. Does that side feel the same? Are you doing the same thing on the right versus the left? Does that foot turn out as much? Are you doing the same sort of chi? Different things will affect your pelvic floor and your movement. If you've ever sprained your ankle or you've broken your ankle and you feel like that side's a little tighter, you might feel like you see different compensations and different cheats on that side versus the opposite side. If you've had knee surgery, there's all sorts of things in your history that will define how you move that affects your pelvic floor over time. And it doesn't matter if your ankle fracture was 10 years ago, it can still be affecting your pelvic floor. And there's still things we can do to assess your movement and improve it so that your pelvic floor can start to engage more. Now, I want you to go back, put one foot forward. I don't care which one. I want you to bend that front knee a little bit. And then I want you to just bump your hip out right to left. Okay, I just want you to do a little hip check. Okay, like you're gonna give somebody a little bump. What's that feel like? Are you like, ooh, my SI doesn't feel so hot? Is your foot rolling? Does your big toe want to sort of lift up? Does your knee feel like it's a little sore because your knee is doing a lot of sort of back and forth, side to side? Again, those are all things in ways your body cheats. What should happen should be that this back foot is straight, the knee is straight, the foot is flat, and your pelvis is truly doing the motion. But for a lot of women, I see the biggest limitations with this side to side motion, okay? Switch sides, take a feel on the other side. Just see what that side feels like. Again, does it feel different? As you do a few repetitions, do you feel like that foot starts wanting to sort of sneak out on you? Because that also will happen too. You sort of start in the right place and then it shifts. Do you feel like you're sort of, as you're going sideways, you're sort of twisting? Do you feel a little bit in your low back? Again, those are ways your body is compensating, which means that your pelvic floor isn't getting the motion it needs to get the blood flow to contract and relax, which means it just gets stuck. And for a lot of women, it gets stuck and it gets weak and it gets tight, and then it can't do all the things that it needs to do, okay? Last one, go back to the other side, because I told you there's different ways your pelvic floor moves. Now, while you're here, I want you to bend that front knee a little bit and just turn towards your back leg. I just want you to do a little twist. Now, does your back foot want to sort of twist with you? Does your big toe sort of lift up in the back? What's your knee doing in the front? Just sort of feel all those things and what your body's doing, and then switch sides and try the other side. Okay. And again, right to left might be very different. Your flexibility might be different one side versus the other. You might be like, ooh, that side's always tight for me. Or maybe you have a side that, gosh, it's my right knee that always bothers me. It's my right low back that always bothers me. That's not a coincidence. If you have pelvic issues and you have a side that's sort of your bad side, most likely what's happening is you're not moving well through your hips, through your pelvis to get your pelvic floor the blood flow it needs, for your pelvic floor to work the way it needs to. And what's happening is you're compensating at other joints in your body, which they've started to become painful and uncomfortable. So the cool thing with pelvic PT and this approach is that often we can kill multiple birds with one stone, meaning that probably feels better. So there's a lot of crossover. And that's, again, I think something that gets missed in pelvic PT, and something we try to address as pelvic floor PTs, is not just putting you on a table. There are things on a table that should be done and can be done and are really helpful, but it is not the end all be all. And so that's sort of, again, where we want to come at tonight. What is the role of your pelvic floor? Yeah, it should keep you from peeing. You should be able to have sex without pain. You shouldn't notice your vagina. It should just sort of work. That's all what it should do. But your pelvic floor, just sort of a reminder, it's the support system for all of your internal organs. Your uterus, your colon, your rectum, your bladder, everything sits within this cavity. And so what I tell people is when your pelvic floor starts to get weak, if you sort of imagine this as your pelvic bowl, I tell people it's like the bottom falls out. So all of a sudden you have, here's your bladder, here's your pelvic floor. It's nice and tightly supported. Now your pelvic floor over time starts to get weak. You lose some mobility, maybe you have some trauma, maybe you have an injury, various things that will affect it. It's like the bottom falls out, and now you have a bladder that can slosh and swish all sorts of places that it shouldn't, which can lead to leaking. It can lead to prolapse issues. What happens when your pelvic floor gets super tight? Okay, I tell women it's like making a fist. Okay, so if you make a fist right now, and then I say to you, well, squeeze tighter. Come on, squeeze tighter. You'd say to me, Britt, you're crazy. I'm already squeezing. I can't squeeze any tighter. That's what happens to your pelvic floor when it's really tight. Okay, one of the jobs of the pelvic floor is to pinch that urethra shut so that nothing leaks out. So that when you're trying to make it home from the grocery store and you really have to pee, that pelvic floor should be able to pinch that urethra shut so nothing comes out. But if the muscles are already tight, they've got nothing left to give. And so things start to leak when they shouldn't. And so again, getting these pelvic muscles strong, getting them mobile, getting blood flow back into them helps them to support your organs better. It helps them to be able to pinch that urethra shut. It also helps them to be able to relax so they can fully open your urethra, because sometimes when the muscles are tight, they keep you from fully emptying. So you can have the issue where it's tough to fully empty your bladder because the muscles are sort of squeezing and pinching that urethra just a little bit where you can't fully empty. Sometimes they can't pinch enough to close it all the way, so you leak. So it seems like you have these opposite issues, but they're being caused by the same thing. Let's talk about pain with sex. When the pelvic floor muscles get tight and they get really clenched, for some people, it creates a trigger point. It creates a spasm. So if you've ever slept wrong, or you've had a lot of tension through your shoulders, through your neck, and you feel like, oh, I got a really tight knot that's there. Your pelvic floor gets knots just the same way. Now, when you have a knot here, do you want somebody to come bang it with a hammer? No, you'd be like, get away from me, that hurts. You want somebody to massage it. You want to loosen it up. So now let's think about when you have trigger points and somebody wants to have sex with you. Does that sound super inviting? Let's go in and just hit into that trigger point. No. So it changes your sex drive. Things get tighter. You stop having sex. Muscles get even more tight. So it's all cycling around together, because the truth is that sex can be a great way to bring in blood flow to your pelvic floor and help it. But if you have so many trigger points that it's just leading to cause more spasm and more tightness, then it doesn't have that effect. And so it's really important to understand that we need to get this pelvic floor the blood flow it needs, because it can cause all sorts of different issues when it starts to get tight and stops functioning. Now, why does one person with a tight pelvic floor end up with bladder issues and somebody else with a tight pelvic floor end up with pain with sex or abdominal cramping or various sorts of pain? It just depends on how your body manifests. I just had you stand up and move. And some of you probably had your foot toeing out. Some of you probably had your knee bending. Some of you probably felt it in your back. Your body will sort of manifest what's happening in different ways. And so it's important to understand that that's why it's great to see a pelvic PT in person who can really assess your whole situation, because there's a lot of factors that can go ahead and play into what your pelvic floor is doing and what symptoms are manifesting with you. Because I can see 2 patients that have a tight pelvic floor in the front, and I can have some of them that have incomplete emptying. I can have some of them that have stress incontinence or leaking. I can have some of them that have abdominal pain, some of them that have pain with sex. Now, the same muscles are tight, but in 4 different women, it can cause completely different symptoms. And so I have to look at the whole picture. I have to look at their diet, because there's different things with diet that can affect your pelvic floor and affect your bladder. There's different things with emotional trauma, stress levels. Think about when you're stressed. People will say, oh, I hold my stress in my shoulders. I can sort of feel it when I'm stressed. A lot of women hold their stress in their pelvic floor. So if you're super stressed, you have a lot going on, anxiety's high, whatever it may be, and your pelvic floor starts to flare, there's a relationship there. And so recognizing that is really huge, figuring out what relaxation techniques work well for you. There's more to treating pelvic health than just doing some Kegels. It's movement. It is looking at the whole picture. It's looking at whether you've had back issues before, you've been in a motor vehicle accident, you've had sexual or emotional or physical trauma. There's so many pieces to the puzzle. And as pelvic PTs, that's our job, is to help you figure out what pieces to the puzzle are impacting your symptoms and how do we then reverse it, which is, again, why I tell people a lot of times we kill multiple birds with one stone, because a lot of times it's all interconnected and related. I wish it was as easy as saying, yeah, go off and do 10 Kegels, like the doctor told Sheena, like, oh yeah, just go do some Kegels and you'll be good. But it's more than that. She was a new mom with hormones. She was a new mom whose body was trying to get back to sort of her normal shape and normal space. She was a new mom that was holding an infant, breastfeeding an infant, so her posture was being affected. Her movement, her exercise was affected. Stress in her relationship just from having a new baby and what that brings. So there's so many pieces to the puzzle. And that's, again, the benefits of pelvic PT, which is why I want you all to sign up for this free exam that we are giving you guys tonight, because a pelvic PT can look at the whole picture with you and help you figure out your leaking is more than just menopause. Your pelvic pain is more than like, yeah, I'm just dry down there now because my hormones are changing. Your stress incontinence, your trouble jumping with your kids on the trampoline, it's more than just saying, yeah, well, I'm a mom, I just had a baby, so, I just have to sort of live with it. There is more to it than that, and there's more to it than genetics, there's more to it than hormones. But that said, it's common, right? You probably talk to a lot of friends or family members or your daughter. It is common to have pelvic floor issues. The stats are 1 in 3 women in some things you read, some say 1 in 4. Regardless, if you think about sitting around with 4 friends, at least one of you has a pelvic issue. That's a pretty high statistic. And it gets higher as women age. Why? Because hormones do impact it, because our activity levels do activate it and impact it, because our injuries and different things, our posture, our daily activities impact it. So there's so many factors that come into play. So yeah, it's really common, but that doesn't mean you have to live with it. It doesn't mean your quality of life has to be changed because of it. You just need to figure out, and again, with a pelvic PT or with the online program, if your schedule's crazy, you're not ready to come in, whatever, but getting the right education, helping to figure out and decode what your body needs. It's more than just blaming your age, blaming your hormones, blaming being a mom. And it's more than just saying, do some Kegels or go have surgery, because I've seen a lot of women who will go have surgery because they think it's sort of a quick fix, but they never fix the real true root cause of the problem. And so, yes, there are times when surgery is necessary, but it's also great to get pelvic PT either before surgery or after you've had surgery, because if you continue to do things the same way, guess what's going to happen? You have a higher likeliness of those surgeries failing. And so I always tell people, I did a webinar similar to this last night, and I had somebody ask, well, I was recommended to have surgery, and should I try exercise first or pelvic PT first? And I said, absolutely, because you can't go back once you've had the surgery, right? But there's no harm in starting to learn how to move and learn how to exercise and working with a PT to sort of figure out the whole puzzle. You might be able to avoid the surgery, or maybe you won't, but you'll be in a much better position to hopefully have a more successful surgery and a better success rate after the surgery. So just things to think about. Now, the last thing I want to think about before we sort of jump back in and do a quick closure and then some Q&A is I want you to think about, you might be listening to this and thinking, well, this all sounds great, but I don't have time. Like, I watch my grandkids. I have kids of my own. I'm working full time. It's the holidays. It's super easy for us to make excuses. And so I want to tell you tonight that we will meet you where you're at. And what I mean by that is that we all have different things in our lives going on. And pelvic PT is not about saying you have to do 100 Kegels a day. You have to devote 30 minutes to exercise every day. Because you know what? Even for me as a pelvic PT, I would be like, yeah, that's not happening. I have some days that I don't exercise, that I'm not able to work out because my kids have sports and I'm working in the clinic and there's laundry to be done and all the things, right? So I want to stress to you guys tonight, don't not sign up for this free exam. Don't not register for my core floor because you think you just don't have time, that it's going to be too big of a commitment. We want to meet you where you're at. We want to figure out what your body needs. We want to meet you where you are right now. And we want to help you find success. If it's something that's overwhelming, you're not going to do it. So you're not going to be successful. And that doesn't help anybody. The reason we're here tonight is because we want you to be successful. We want women to understand their bodies better and to know that they have tools that they can use and that their body can be the solution, can help them to actually feel better. And so I want you to know that we're going to meet you where you're at. Okay. I want you to know that this doesn't require you to spend hours a day on your pelvic floor. I often compare it to teeth brushing. And you might be thinking, wow, Britt, my vagina and my mouth are very far apart and two very different things. But I want you to hear me out. When we're really little, we start learning about dental health, right? Brush your teeth for 2 minutes in the morning, brush it for 2 minutes at night, floss, whatever. And then you go to the dentist twice a year and your dental health's pretty good, right? Imagine if you spent 2 minutes a day in the morning and 2 minutes a day at night on your pelvic health. Because I guarantee no matter how busy you are, you make time to brush your teeth, right? Because it's just part of your routine. It's just what you do. What if you devoted 4 minutes a day to your pelvic health? If it just became part of your routine? What if I have some patients, I say, do it after you brush your teeth. Pick 1 or 2 exercises and just do them real quick while you're in the bathroom. It doesn't need a lot of weights. You don't need a lot of space. You don't need a ton of time. But if you're consistent and you can devote devoting a tiny bit, it might take a little longer to get there, but I guarantee you will start moving in the right direction. The worst thing you can do is just be like, I'll just live with it. And maybe you're okay with living with it. But I want you to know you don't have to. And I want you to know that it doesn't have to take a lot of time and that we want to meet you where you're at today. Because life is constantly changing and we want to know that we can give you the tools to be able to start seeing some success, even starting now. Okay. I'm going to pull my screen back up here quickly and start to do a little closeout here. So my reminder, okay, it's worth $75 and we are giving it free tonight. So everybody, my goal is to have everybody on this webinar tonight jumping in for this free exam. We're only offering it to you guys that are here live. It's a special thing. We want to help you. We want to be able to offer you all the things that I'm talking about here tonight. Somebody really assessing your whole picture and looking at your movement and looking at your pelvic floor and looking at where you're at today. What have I learned as a physical therapist for the last 20 years? Well, let me tell you. I learned one, we're all made to move. Our bodies want to move. They crave movement, and movement can be the key to your success. I've learned that as adults, me included some days, we do not move enough. We spend a lot of time sitting, a lot of times with our pelvis fixed. I've learned that we get stuck. A lot of us can sort of say there are certain things that we always do, certain patterns we're always in. We're always bent over, picking up laundry, bent over, taking care of a kid, bent over a computer, bent over a steering wheel to drive. We get stuck in patterns and our bodies just get stuck moving the same way all the time and things start to lock up. And that's where pelvic PT, where my core floor can start to get you unstuck. It's not going to take away all the things you still have to do. You still have to bathe your baby and you still have to go to work and sit at your computer, but we're going to give you some tools to break up those stuck patterns that get you in trouble. Okay. I've learned that we should not and do not need to think about our vaginas or our pelvic floor muscles in order to get them to work well. You didn't think about them when you were a kid. You didn't think about them when you first potty trained. You didn't think about them when you were first sexually active. So why now? Why do we have to consciously think about everything our pelvic floors do? You don't. And these strategies that I'm talking about tonight are how you start getting your life back. You have enough to think about. You don't need to be thinking about your vagina and whether you should be crossing your legs or squeezing or holding or bracing, okay? I've learned that everyone's results vary, right? Everyone's coming in at different abilities, different injuries, different diagnoses, but everybody sees some level of improvement with pelvic PT or with the online program. Everybody. because everyone benefits from learning to move better and learning to move in different ways and engaging those muscles. So even clients who sometimes end up needing surgery will tell me, wow, but my hips feel better. I'm moving better. I am engaging things better. Everyone will see results on some level if you do the program, if you devote a couple minutes a day, okay? Just a little bit of time will help you to find success. So 3 things you need to know before we jump off here tonight, okay? Number 1, there's no magic wand. I wish there was a magic wand because my line for pelvic PT would be even longer than it already is if I could magically sort of wave away these problems, but there isn't a magic wand. You need to put in a little work. It doesn't need to be a lot. Okay, it doesn't need to disrupt your entire life and schedule, but you need to put in a little bit, okay? You need to make time. And again, the time might be literally a minute after you brush your teeth. Instead of spending 2 minutes in the bathroom, you spend 3 minutes because you do 2 on your teeth and 1 on your pelvic floor. So a little bit of time can go a long way with pelvic health. So you have 3 choices as you leave here tonight, okay? 1, you can choose to do nothing. You can just be like, you know what, this isn't for me, and that's okay. We're all coming in, again, like I said, at different places, at different spaces in our lives. And maybe it's not for you today, but maybe it will be in a month or in a week. And so keep us in mind if you're sort of at that space where you're like, it's not for me today. Remember that the iMove Pelvic Floor team, we want to help you. Remember that we're offering you this free service, my online program, to be able to start to get some access. So if you're at a do nothing place right now, that's okay. Have some grace with yourself and sort of know that that's okay, but don't forget that this is out there and we're here for you and we're here to support you through it. What I do want you to remember though, is that there is a price of doing nothing. And sometimes we don't think about this because we just get so used to sort of accommodating our lives to the problems we have. And what do we start missing out on? Or what do we start adjusting? I've had clients who will tell me that if they're going to a new restaurant, they need to know where the bathroom is when they first get there, or they don't go to a new place with their friends because they're afraid there won't be a bathroom they can get to in time, or they'll be afraid they don't know where the bathroom is. And what if they get into trouble? I have people who start letting it affect their relationships because they're no longer intimate with their partners, and it starts to play an impact on your emotional relationship, your physical relationship. I have people who will take their kids to the trampoline park, and when their kids want them to come run and jump and play with them on the trampoline, they have to sit on the side because they're not comfortable. They know they're going to wet their pants. So they have to sort of miss out on that. I have grandparents, grandmothers that I work with that want to be able to play with their kids and the grandkids in the yard. So what do you start missing out on? Where do you start sort of changing your life because of these issues when maybe you don't have to? And so that's what I just want you guys to think about tonight. It's not a guilt trip. It's not a, you have to do this. It's a, we want you guys to have the best quality of life. We're only here for a certain amount of time around the sun, and we want you to have the best quality of life doing that. We want you to understand your bodies and understand how you can improve it and not have to live with these issues. And so I just want you guys to think about that tonight, okay? No one wants to have to pack a change of clothes or worry about pads or worry about bathroom locations, okay? So just think about those things and how we can maybe help you to not have to think about it, okay? Another option is to do it alone. I have a lot of patients who try going to YouTube and they try to, you know, go through some Facebook videos and see if they can sort of figure out what to do for themselves. But that's tough to do. It's hard to know if the exercises you're seeing on YouTube or you're reading about on Facebook, are they the right ones for you? Are they going to work what your pelvic floor needs? So you can go at it alone. It's an option. We live in a world of abundance of information. The hard part is not knowing necessarily what information is good, what information is bad, what information is for you. And that's where having a screen with a pelvic floor PT can help you get on track just for you. It's where jumping into My Core Floor, taking the quiz, getting a personalized program can be really helpful. It's a step-by-step process. So you're not having to just sort of guess and figure out what might be for you. But it's an option. It's something you guys can do. Or you can choose the third option, which is my favorite, and I think the best one of all of them, which is let us help you. Let us support you. Let us at iMove be your place to be for your pelvic floor needs. Let My Core Floor be your accent. Let it be the place you go to for a quick 5-minute workout on a busy day. Okay, let us be your support system. Let us be your pelvic PTs. Join all of the other women that have done the same thing, okay, that have been, these are actually pictures of real live My Core Floor women who are on there, who let me steal their photos to show for the webinar. You will notice if you look at these pictures, there are women of all ages, sizes, abilities, and injuries, and we all come together to work out in my core floor, sometimes live, sometimes pre-recorded, sometimes in a sort of group meeting on a Facebook Live. But women of all ages, abilities are finding success with pelvic floor PT and with my core floor. We want you to be one too. These are just a couple quick testimonials. I asked some of my members if they would sort of give me some of the things they love about my core floor. One woman said, I love it because it gives me agency over my own well-being, my own physical health, and that's empowering. It's empowering to know that your body can be the solution and not having to rely on meds and pads and all these things. I found the information invaluable in helping me understand my core floor. The exercises and quick 10-minute workouts are great for me. The pelvic floor anatomy was fantastic. I appreciate the candid and clear descriptions. We keep it easy, guys. I don't want to talk to you about which muscle this is. It doesn't matter to you. You don't care what the name of the muscle is. You just want it to work. And so that's where we meet you at. We meet you where you're at. It's not technical. It's coming from somebody who has the technical background. It's coming from our pelvic health team. But we come at you in real terms, in real life, with real women, okay? I'm feeling a difference already in my core. This is exactly what I needed. I love the workouts. They make a difference, and it's nice to connect. That's the other thing. It's great to have the community aspect and be able to connect with other women who get what you're going through. So you have a choice tonight. What do you want your future to look like? Do you want to keep dealing with some of these pesky problems, or do you want to start making some changes and start today? Best time to start was yesterday, but as this unknown author says, the next best time to start is now. But you might still be wondering, can this work for me? The exercises are easy. They fit into anyone's schedule. I can actually say I'm not afraid of sneezing anymore. These are, again, real life people who have said that they've found success with these exercises and with this approach. I've learned so much about ways to be proactive. I like being connected to other women who need this information. Exercises are easy to incorporate into a busy day. I told you guys, I get it. I'm a busy mom. I'm a busy professional. And I know that we don't have a ton of time. So we make it work for you. We meet you where you're at. It's a nice surprise. I wasn't expecting improvements this quickly. Okay. If you're consistent and you put a little time in, you will be amazed. I usually have most women, I'll tell them within 4 to 6 weeks, you start seeing changes, which is awesome. Especially women who have dealt with these problems for years. Okay. So tonight we're going to offer you a solution to all your pelvic floor problems. Okay. The in-person screening, valued at 75%. I challenge all of you to sign up for this screening, because why not? What do you have to lose? We want to help you. Everybody's different. The causes can be different. Your body's needs are different, and we want to help you take back control. We want you to be in control of your bladder, not your bladder or your pelvic floor to be in control of you, okay? Make sure you sign up for my core floor. It's free. Why not? You can come hang out with me and some live Q&A. You guys join me and come get some access to some great information. A lot of what we talked about tonight. The thing is that my core floor, if you guys pay for it, if you were to buy an annual subscription, it costs $300. Okay. If you were going to pay for a half-hour screening with PT, it's $75. So for tonight, we're giving you for $375 free. We're giving it for free. Why? Because iMove wants you to be better. Our pelvic health team wants you to see changes. We want the improvement. So we're going to give it to you tonight for free. So take advantage. We would love to have you guys join us and get on your pelvic health journey. We believe every woman is entitled to good pelvic health. That's why we're here tonight. We believe that money shouldn't be a limiting factor for you guys getting good education, good exercises, and good treatment. We want to meet you where you're at. Okay. It doesn't have to be this set 1 hour a day to your pelvic health. It's not realistic. It's not realistic for me, and I'm a pelvic PT. So why would it be realistic for you? We want to meet you where you're at, and we want to help you decode what's best for you. For some people, coming in for that screening is going to be great. Working with our team one-on-one is going to be great. For some of you, maybe it's just you take us up on our 10-minute phone call consult. You just give us a quick call, chat with one of our pelvic PTs, sort of figure out what is best for you. Or maybe you just want to start online and sort of see where it goes, get an idea, sort of feel it out, and then come in for a screening or give us a call. We want to help you figure out what your needs are and what's going to be best for you, because it's going to be a little different for everybody, okay? Just a reminder, this program, none of it, it's not there if you're not ready, okay? It's not there if you're just looking for a magic wand. You got to put in a little bit of work, just a little, okay? it's not for you if you don't want to make a change. And it's not for you if you're sort of thinking, well, this isn't going to work for me. Okay. Success for anything in life doesn't just happen. Okay. You have to sort of be devoted to it. You have to believe in it, and you have to put in a little bit of time. Okay. So you might still be wondering, can this work for me? Remember Sheena in the beginning? This is a post she put in my Facebook group not that long ago. I've been doing my quick squats and stretches before every workout I do, and the crotch of my workout pants continues to be dry. As you can see, Sheena's pretty straightforward. She just tells it like it is, but it's the truth, right? She feels good, and she's incorporated this into the other things she does. She does some of the my core floor stuff before she runs, before she does a beach body workout, before she goes and plays on the trampoline with her kids. And so we can make it work for your life, just like Sheena made it work for her. So the answer to that question, can it work for you, is absolutely yes. We can help make it work for you. So you have a decision. What are you going to choose? That is the completion of tonight's webinar. Okay.